And now here is a video featuring Dr. Mitchell Guttenplan, the former co-medical director of Hemorrhoid Centers of America, Atlanta. And he is now the medical director of CRH Medical, the manufacturer of the O'Regan ligator.
Hi, my name is Mitch Guttenplan. I'm a general surgeon, and I serve as the medical director of CRH Medical. You're about to have a procedure done for your hemorrhoid disease, and we wanted to review a few things about the procedure, what you can expect, and then of course if there's any questions afterwards, please feel free to ask your provider. Basically, everyone is born with hemorrhoids. We're born with 3 columns of hemorrhoids. There's 1 on the left and 2 on the right, and everybody's got them. In Western society, hemorrhoid disease is very, very prevalent. 50% of people will have symptoms by the age of 50, and 75% of people will have hemorrhoid symptoms at some point in their life. And the reason that these problems occur is because the hemorrhoids, which are normally held up in a certain position up in the lower part of the rectum, they tend to loosen and tend to start to slip and slide or prolapse. Generally speaking, if one hemorrhoid is causing an issue, all the hemorrhoids are causing an issue. And so generally, all 3 hemorrhoids need to be treated. We prefer to treat 1 hemorrhoid at a setting, and the main reason for that is if you only do 1 hemorrhoid at a setting, the complications are much lower. We'll talk about the complications in a minute, but if you do 1 hemorrhoid at a setting, the complications are less than 1%. Rubber band ligation's been around since the 60s. What's special about this device is where the bands are placed and the way the bands are placed. If you look at this diagram and you see this prolapsing hemorrhoid, we're going to put the rubber band up at the top of the hemorrhoid. That rubber band will choke off the blood supply to that little bit of tissue. The tissue will die and it will slough and it will fall off. This tissue that dies and sloughs off will cause a scar to occur. And when that scar occurs, the hemorrhoid, which wants to sag and prolapse, will scar back into place, will stop prolapsing, all the problems go away. It's the prolapse that causes the hemorrhoidal symptoms. And to be frank, it's the prolapse that we're trying to fix with this device and this procedure. It does not require any preparation, no enemas. You don't have to come in without having anything to eat. You don't have to fast after midnight. No sedation. It's generally done in an office setting. You're laying on your left side with both of your knees drawn up towards your tummy. And then we'll examine your bottom with a finger. And then, in many of you, we will examine your bottom with what's called an anoscope. It's a very small plastic scope so that we can see inside, see exactly what the hemorrhoids are, and then we use this device in order to band the hemorrhoids. We deploy the band, and then we will do another exam to make sure that the band is in good position and to make sure that we have enough tissue, we don't have too much tissue, and we can adjust the band if necessary. If you're having any pain or any pinching, even a little, please let your provider know. That little pinch or that little pain, if left alone, would get worse, and we can make it go away just by adjusting the band. So I like to tell my patients, I don't want you to be brave on this one. I want you to be a wimp, and I want you to tell me, do you have any pain or any pinching? You should just feel a little bit of pressure, and that pressure should get better in a few hours. Now, any procedure that you have done does have the potential of having complications. Fortunately, with this procedure, the complication rate is very low. It's 1% or less. The complications include post-banding pain, post-banding bleeding, urinary symptoms. The urinary symptoms typically happen in a male that has prostate issues, but they can occur, and a very, very, very rare risk of infection. Again, all of those put together are 1%. A little bit of bleeding after the procedure is very common. So please don't be alarmed if you see a little bit of blood on the toilet tissue or sometimes a drop or 2 of blood that'll drip into the toilet water afterwards. That bleeding can be today. It can be in a few days when that tissue sloughs off. And it can be in a couple of weeks when the scab that is left behind, we call it an eschar, separates from that ulcer bed. And so a little bit of bleeding is not a big deal, but significant bleeding, fortunately, is very rare and can be controlled quite easily, though, if it does occur. So all of those are 1%. If we were to do more than 1 hemorrhoid at a time, then the risk would jump to between 6 and 10%, and that's why we do 1 at a time. Depending on what you have, Your provider may also provide you with prescriptions. Many people with hemorrhoids have rashes that need to be dealt with. Many of them have spasm of the sphincter muscles in that area that need to be addressed with topical ointments. And many will also have fissures, which are little cuts or tears that need to be treated as well. And again, your provider can give you all of that information. Now, for those of you that have external hemorrhoids, please understand that these rubber bands are placed on the internal hemorrhoids. If we put the rubber bands on the external hemorrhoids, you will have a lot of pain. People will often ask, well, my external hemorrhoids are the ones that are bothering me. Generally speaking, that's not true. Generally speaking, we think the external hemorrhoids are responsible for the symptoms. It's really the internals, and that's why 90% of the time when you place the bands up high on the internal hemorrhoids, the symptoms go away. And between the combination of great success and very low rate of problems, it really has turned into be the gold standard for treatment of hemorrhoids in a non-surgical manner. If you have any questions about this, again, please ask your provider. We also have information on our website, CRHsystem.com. Thank you very much and have a great day.